Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In rheumatoid arthritis, the pathogenesis of rheumatoid arthritis. So, in the pathogenesis of rheumatoid arthritis, women are more commonly affected than men, and they are around 30 to 50 years of age. And HLA-DR4 is actually a risk factor for rheumatoid arthritis. So initially the disease is mainly present in the synovial membrane, and it has three phases. It has an initiation phase. In the initiation phase is mainly due to the non-specific inflammation will result in initiation phase. Then we have amplification phase. In amplification phase occurs mainly due to the non-specific inflammation will result in amplification phase. Then we also have chronic inflammatory phase. Okay, chronic inflammatory phase is mainly due to the cytokines. The chronic inflammatory phase is due to the cytokines like interleukin 1, tumor necrosis factor alpha, and interleukin 6 will result in chronic inflammatory phase. So these three will result in inflammation of the joints and the cavities.
thank you and thank you for watching.